The truth about Ayushman Bharat Yojana. Which diseases are not covered? Know the full list or you may regret it. Imagine, suddenly, late at night, you feel chest pain. Your family panics and rushes you to the hospital, and you are relaxed, thinking, I have an Ayushman card, everything will be covered. But when the bill is prepared at the counter, you are told that this expense is not included in the scheme. The fear begins right there. The curiosity is this. What diseases does the world's largest government health insurance scheme actually not cover? And this story matters because it is not just about treatment, but about awareness. Today, we are talking about Ayushman Bharat Yojana, also known as PMJAY. Launched in 2018, the objective of this scheme was to provide cashless treatment up to 5 lakh rupees to poor and vulnerable families. According to the government, crores of beneficiaries fall under its coverage. It is called the world's largest publicly funded health insurance scheme. According to data from the National Health Authority, lakhs of hospital admissions have already taken place under this scheme. But often a misconception spreads that having an Ayushman card means free treatment for every disease. The truth is slightly different. First of all, it is important to understand that this scheme primarily provides hospitalization-based coverage. That means the package applies only when the patient is admitted to the hospital. This also means that OPD or outpatient department expenses are generally not covered. If you need to consult a doctor for a common cold, fever, or mild illness, and you are not admitted, then the consultation fee and medicines will have to be paid by you. This is where most people get confused. Now let's talk about cosmetic surgery. A nose job, liposuction, hair transplant, or elective plastic surgeries done for enhancing appearance are not covered under this scheme. However, if the face or any part of the body is damaged in an accident and reconstructive surgery is medically necessary, that is a different matter. In other words, a clear distinction is made between medical necessity and cosmetic preference. Fertility treatment is also outside the scope of the scheme. Infertility treatment, IVF procedures, IUI, or other reproductive technologies are not included under PMJAY. This decision was taken because the main focus of the scheme is on life-threatening or serious illnesses. Procedures like IVF are expensive and long-term, and they are not categorized as public health emergencies. De-addiction programs for alcohol or drugs are generally not covered under this scheme either. While some mental health treatment packages may be included, the full cost of substance abuse rehabilitation is not covered. This is another area where people often have misconceptions. The issue of organ transplant is a bit complex. Procedures like kidney transplant and liver transplant are extremely expensive. In some states, limited packages are available, but donor costs, post-transplant medication, and long-term care are not fully covered. This largely depends on state-specific guidelines. Therefore, beneficiaries must check the list applicable in their state. Getting spectacles made, routine eye checkups, or hearing aids are also outside the scope of this scheme. So if you need glasses or a hearing device, that expense will have to be borne by you. The scheme's goal is life-saving interventions, not routine corrective aids. The rules regarding medicines after hospital discharge are also clear. Medicines and tests up to 3 days before admission and around 15 days after discharge may be included in the package. But long-term medicines after that, such as ongoing medicines for chronic diabetes or hypertension, must be purchased by you. So considering the Ayushman card as complete health cover can be risky. Now it is equally important to understand what is actually covered. Cancer treatment, heart surgery, angioplasty, bypass surgery, kidney failure management, knee replacement, neurosurgery, and other serious illnesses are included. Package rates are predefined. Unlike private insurance, pre-existing diseases are covered from day one. This is a major advantage of the scheme. According to recent rules, senior citizens above 70 years of age have been given the provision of separate coverage up to 5 lakh rupees, regardless of their income. This step is considered important in providing financial protection to the elderly population. In India, healthcare costs are rising rapidly, and the elderly are more vulnerable. Data from the National Sample Survey shows that out-of-pocket health expenditure in India is still high. Many families fall below the poverty line due to treatment expenses. It was in this background that a scheme like Ayushman Bharat was introduced. But due to lack of awareness, people develop wrong expectations. This scheme runs on a package-based system. Every disease or procedure has a predefined package rate, which includes surgery, medicines, diagnostics, and hospitalization. The hospital directly claims reimbursement from the National Health Authority. The beneficiary receives cashless treatment. But if any service is not in the package list, that expense will not be covered. Another important fact is that not every hospital is empaneled under the scheme. Only those hospitals registered under the scheme can provide cashless treatment. Therefore, before going to any hospital in an emergency, it is important to check its empanelment status. Digital verification is also part of the scheme. Beneficiary identification may be Aadhaar-based or ration card based. To prevent fraud, there is a process of e-card generation and claim audits. Even so, in some cases, complaints of misuse or overbilling have surfaced, and monitoring systems are being strengthened to address them. The broader vision of Ayushman Bharat is not just insurance, but also strengthening primary healthcare. Health and wellness centers have been established alongside it, so that preventive care and screening services are available. However, the gap between hospitalization coverage and preventive care still exists at the level of awareness. For the common citizen, it is important to understand that the Ayushman card is an emergency shield, not a daily health wallet. Considering it comprehensive insurance can be misleading. OPD, routine medicines, cosmetic procedures, fertility treatment, de-addiction services, and many elective interventions are not included. Yet despite this, the scheme has proven life-saving for lakhs of families. When heart surgery or cancer treatment costing lakhs of rupees becomes cashless, a family is saved from financial catastrophe. That is the core objective of the scheme, to reduce catastrophic health expenditure. Awareness is the real protection. If you know what is covered and what is not, you can plan your finances better. Ayushman Bharat is a strong foundation, but for complete protection, supplementary planning may be necessary. The next time you look at your Ayushman card, see it as a powerful tool, but also recognize its limitations. Because the right information is the real insurance. And that is the most important message of this story. Awareness is essential before treatment, otherwise confusion during an emergency can become the biggest risk.
If our video has taught you something new, do not forget to like and share this video so that this information can reach others as well. Your likes and shares are a source of inspiration for us. If you have any questions or suggestions, please let us know in the comments. It will be our honor to answer your questions and listen to suggestions. And yes, if you like our content, subscribe to the channel and press the bell icon so that you stay connected with every new story. Thank you. GRT Business YouTube channel sources: news from various news agencies, opinion polls, and other public sources. We try to ensure that every report and summary is accurate and verified, but we are not responsible for any dispute or error. Our aim is only to provide you with accurate information.